I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Today we're going to talk about how to have healthy kids. And we were getting some feedback from patients that have been radio listeners for a long time, and I always ask, is there a subject you'd like us to talk about that we haven't covered in a long time? Sure. And one was children's health. We're going to cover that today.
Very important area.
Right. One of the questions I think people ask, well, aren't children normally healthy?
Oh, yeah, and I get that, because I sit there and I tell the parents that, we need to get, your kids in here just to get them checked out. And they said, oh, kids are always healthy. And that's a very big misnomer. Mm-hmm. Because when you're talking about the growth, the diet, all the different types of things that go into childhood, when we do blood work on children, very few of them actually are in a normal range, because of the stressors that go on. And when you're talking about most of the world, here in the United States, we think of kids as being healthy. It's adults when we start getting sick. But childhood mortality is really high across the world, where we have a lot of health issues. But in the United States, we also do have a problem with infant and childhood mortality. We, of all the developed nations, we have the worst infant and childhood mortality rates.
You're talking about right now?
Right now.
Really?
Yes.
Wow.
So, when you're talking about who has the best childhood mortality rates, it's the Japanese, actually, who do a very good job on that. They have the lowest infant mortality rate of any of the countries. And one of the things, of course, that's they sit there and they say, why? And, why is that? That's a real good question. Those are some of the things that we need to study and find out.
I'm really kind of shocked by that.
Yeah, I know. You would think, because we do have the best disease care model in the world. Where we spend the most, have the most research, have the most availability of the pharmaceutical surgeries, vaccinations. Our vaccination, the number of vaccinations that we do for children is twice as high as the next country that has the vaccination rate.
You're saying it's double.
It's double the number of vaccinations we give to the country which is the next, gives the most vaccinations after that. The country that gives the least amount of vaccinations and has no requirement on it is Japan. And
they have the best infant and child
mortality rates and health of their children.
Interesting.
Now, when you go to non-developed countries, infant mortality and childhood mortality is extremely high. It used to be one of the most dangerous points in your life was as a child. The reason that we've made a lot of progress along those lines, but we still need to really look at what's going on in the United States. And we need to take our kids' health and well-being much more seriously. We have an awful lot of problems that are going on in this country. And the infant and childhood disease rates are going way up. We have more problems with our infants and children with their health levels here in the United States than in any other developed country in the world.
And I think, too, our children have a hard time communicating.
Correct.
Especially infants and toddlers, how they're feeling or that. And that, I think, could be part of why we think they're doing fine.
Sure.
And that's why you say it's so important. They get their checkups.
Yes.
They get blood work, and we're gonna talk about that. But why was childhood a dangerous time? And are you saying this is past?
Oh, well, it definitely infant mortality rates have gone down, quite a bit. they're actually starting to kind of go up recently because of all the different types of healthcare concerns that we have at this point. But back in the older days, children died on a regular basis. Also, when you go to third world countries where they're not developed, there's a very high infant mortality rate. The reason is because of sanitation. Children have a weaker immune system than adults do. There's an awful lot that's involved with that, but they have a weaker immune system. And infections, sanitations, one of the biggest things that kills children is diarrhea. So if you had poor sanitation, kids aren't the best on what they put in their mouth. And if you have poor sanitation and they get an intestinal infection and have diarrhea, oftentimes they would become so dehydrated that they would actually die. So one of the things, as we were studying in school on public health, going through college, two of the things that made the biggest difference on the infant mortality rate was, of course, sanitation, and then IVs to get fluids back into kids. That really changed the...
when they got dehydrated.
When they got dehydrated, you just give them IV, get their fluids level back up, and then you wouldn't have the death rate that was so common.
So why are children's immune systems different than adults?
Well, the immune system for adults is bone marrow based. For children, we consider it thymus based.
Oh, interesting.
So, as a child has about a thymus that's about 4 times larger than an adult's, and when they reach puberty, then that thymus actually shrinks, and the whole immune system shifts over to the bone marrow.
So the thymus on a child is 4 times larger than an adult.
Than an adult, because it's a thymus-based immune system. Because the immune system for an adult is much, much stronger. The reason it can be is because we're not growing anymore. So the childhood immune system...
Well, that would be debatable.
Well, yeah, I know.
Maybe not
at least
up
and down. Yeah, right. So, you have to have a different immune system for a child because you have the growth that's going on. And the immune system, our adult immune system isn't compatible with that. So children physiologically, immunologically, are completely different than adults. So understanding children is like looking at a whole different creature. They aren't the same. So, that's one of the reasons...
Is creature the right word?
Yeah, I get. Well, a lot of moms have said, yeah, here comes the creature. So, it's a totally different type of package. Physiologically, that just studying children and how they respond to things is totally different than an adult.
So you have to...
And their sensitivity is much, much greater.
Just look at them differently.
Yes, and as you're evaluating them and treating them, you cannot apply the rules of an adult to a child.
So do you have a theory why the thymus is dominant in the children? Or?
Well, that is a major portion of the immune system. So even as you're reading the white blood cells and the immunology of the children, you're going to see different ratios on that than for an adult. What's normal in a child is not what's normal in an adult.
Well, when you think of children and how fast they grow, we have 2 little grandsons that we're watching grow.
Sure.
It's unbelievable.
Right. And that is a very big stress on the body. Their nutritional needs are different. So, looking at that, and that has a huge effect on their health and well-being.
Interesting. So what has improved childhood mortality? You talked about sanitation.
Sanitation has been is really by far the biggest thing that's really made a huge difference. We've been able to actually get our population clean water, food that isn't contaminated.
Well, that's debatable too, because we're having issues here even in Indiana.
Yeah.
about that.
And that is one thing, but they do have minimum standards here. But yes, water...
Things are happening in our environment that are affecting children.
There is, and there's a lot of changes that are taking place. So we're taking care of some problems, but actually creating some new ones, which is actually showing up in our childhood population, where there's a lot of changes that are taking place, an awful lot of problems that have developed.
So what are some present risks for children?
When we're talking about risk for kids, we have a whole new set of them. Mm-hmm. We have obesity that never used to be a problem. So, we hardly ever had children who were obese, and that's becoming, in some states, almost 25% of the population has an obesity problem. So obesity has just taken off throughout the entire United States. It's an epidemic. Mm-hmm. If you go back to the 1970s, and there was only one state that had a 10% obesity rate, and that was Mississippi. None of the other states had actually reached an obesity rate of 10%. And that was within the adults.
And that's 1970s.
In the 1970s.
Wasn't that long ago.
Yeah. And then nowadays, when we're talking about the obesity rate, there isn't any state that's under... The best state that has the lowest obesity rate is Colorado, and they're at 25%. Mm-hmm. We have states that are at 60%. Of an obesity rate.
Oh my gosh!
And this has not only hit the adults, but it has also hit the children too.
When we come back, let's talk more on how to have healthy kids. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What is ECP therapy?
ECP stands for External Counterpulsation Therapy. And just to put it into a nutshell, ECP is an aerobic exercise machine. Now, you sit there and say, well, why do you need an aerobic exercise machine? It is the number one treatment for cardiovascular disease. If you look at the research and want to find out, well, how do I fix my cardiovascular disease, whatever it might be, always within the scientific literature, aerobic exercise is one of the most proven, most effective means of reversing cardiovascular disease. So, but the problem is I have people who I sit there and I look at them and I say, well, what do I do about this problem that I have, Doc? And I said, well, go out and run 5 miles, every day. And of course they all laugh because it took every effort that they had from going to the waiting room into the exam room,
right.
And they're out of breath. So that didn't work. So what was actually done was develop a machine that actually simulates the effects on the body of aerobic exercise, and that's where ECP comes in. And what occurs with ECP is that there's actually a second heart kind of put into the body. Mm-hmm. It's on the outside, but as the heart goes into relaxation, that's when it actually gets its blood. So what we do is we actually have blood pressure cuffs around the legs. It presses on the legs, and we get a huge amount of blood that goes back up to the heart. And the heart is very regenerative, and you get about 10 times as much oxygen with this particular type of treatment than what you normally would. And you get a regeneration of the heart. You also get a cleaning out of the arteries, and you actually get a huge amount of changes in the whole physiology of the body. So all the benefits of aerobic exercise are actually found in ECP, which are absolutely the number one way that you can be able to reverse cardiovascular disease, diabetes, and many other problems.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. Have you ever been curious about how acupuncture can benefit your health? The Prather Practice has received the Indy A-List Award for Best in Acupuncture for 2 years in a row, and we've been rated the top acupuncture provider by Google+. Dr. Robert Prather is a board-certified licensed acupuncturist. He's earned a reputation for combining effective acupuncture-based techniques with cutting-edge technology to help patients with many conditions. Acupuncture is documented and proven to help with many health issues, including pain, allergies, addiction control, anxiety, fatigue, vision problems, infertility, and so much more. We even have needle-free options for those who are a bit squeamish around needles. Call the Prather Practice to schedule your appointment and experience the benefits of acupuncture for yourself. 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about how to have healthy kids. And we're going right when we went into break about what are some present risks. And you were talking about obesity. Why has obesity become such an issue for children?
We don't know. Now, there's a lot of theories on that that show up. One of the things that I feel is, as we looked at and compared to different countries, the French had an extremely low obesity rate while ours was going up. They actually took in more calories than we did. So they had more calories, but didn't have the obesity rate that Americans were having. Now, that has actually started to change now that they have chemicals added to their foods. So one of the things that has really occurred in a correlation with the obesity rate hasn't really been the big
Calorie
problems with the
intake.
calorie intake. The biggest thing is the chemicals that we actually put in our food. There's a very strong correlation on that, and that's where I feel that we're really having the issues. Now, there is also a sedentary type of a lifestyle that we have developed. Kids used to get out and play all the time, and a lot more activity, but that still doesn't account for the obesity rate. Whereas the chemicals in our food really has a very strong correlation along those lines. So, as we tell people, one of the things that to really cut down on your problems with that, with obesity, is to try to get fresh foods. The French, they would actually buy their food that morning. No chemicals in their foods. It was all fresh type of things prepared and then eaten on that day, and that makes all the difference in the world. So, as you go around and you get packaged foods and preserve this and preserve that, and you look at your food list on that and you can't pronounce the things, the body really doesn't know what to do with those things as you take them in. We're not used to doing that. So what does the body do with those chemicals that it's not used to handling? Well, what it does is if it can't process it, then it will form a fat cell, pop the toxin into the fat cell, and then go store it because it can't really deal with that. So oftentimes what we're talking about is that we are poisoned, over-toxified people. And that's where we get our huge obesity rates. No pun intended. Huge obesity rates.
Oh, I got it.
So, first thing that we really need
I'm
to
still
do is
stuck on picturing the fat cell and the toxins going right in there.
Right.
Yeah.
So toxicity is a very big problem with obesity, and there's a very strong correlation on that. I have a friend of mine who is African origin, and he comes to goes back and forth between Africa and the United States. And as he says, when I come to the United States, I can just I just automatically put on 40 pounds.
Wow.
Within 3 months. When I go back to Africa, and I even eat more. I take in more calories. I indulge myself, and I lose those 40 pounds just like that.
Yeah, when I was in Africa, I ate really healthy, and I was in one of the poorest countries in the world.
Right.
Yeah.
So
the grains and
fruits and
yeah, all natural.
All natural. The meat is antibiotic.
And the people
chemical.
in the villages had the healthy teeth.
Yes.
Yeah.
And teeth is a very big indicator of the nutritional quality of the individual. So what we're talking about is a toxicity that we've added to our food, and a lot of that has to do with convenience, because I need something already prepared. They need to preserve that so it doesn't spoil. They also add chemicals to it. Do you remember what the old TV dinners were like? That you used to eat?
I didn't used to eat. Mom, no, we never had TV
they were
dinners.
Horrible.
But,
I remember trying one, and it was just like, yuck. That was their first attempts to try to make foods palatable over a long period of time. Nowadays, you can't hardly even tell the difference. And what they did was they got with the chemical companies and the perfume companies, because they found that a lot of taste actually has to do with smell. So they add perfumes to it. They add chemicals
We're eating
into
perfume.
Yes. and all those different types of things to make food still to be there for a couple of months and still taste palatable after you're done.
Wow.
Whereas food used to rot and you could tell that it wasn't fresh.
Yeah.
Now you can't tell.
Well, I breastfed my children, and then the decision when they started solid food, and I'm not going to be the type to do, make my own baby food. I give a lot of credit for those women out there,
Right.
But there was an organic baby food brand, Earth's Best.
Right.
Back 25 years ago. I think Earth's Best is still around, where we started them out on the organic food right away. So
and basically, when you're talking about organic food, what you should actually change is organic food should be called food, non-organic food should be called chemical food. So they should actually have the label on it, not the organic stuff,
right?
Because that's real food. Or even change it organic to real food, then fake food.
I'll appreciate that.
Yeah, I think they're going to. I think the companies are going to jump on that one.
And organic isn't always prettier, That's the thing too. Well, let's talk about the role of structure function care. That's the type of care we do at the Prather practice. Play in obesity.
Well, of course, how you eat. We try to train people to eat correctly. Eat what God intended them to, what nature intended them to, is one of the biggest things. The other thing is that we work on doing an evaluation. We look at the endocrine system, make sure that that's functioning correctly. We look at the gut to see if it's healthy, if you have the toxins in there. We're looking at the metabolic rate. We are looking at just how the whole, if the system is over toxified, do we need to detoxify the system? All those different types of things go into it when you're talking about disease care. And let me just tell you the difference between structure function and disease care.
Yeah, that'd be good to define that.
Structure function care is where you bring the body back into homeostasis where it's supposed to work. There is a balance and a perfect spot for perfect health. Health is defined as homeostasis, and homeostasis is defined as balance. And we talk about structure function because both of those have to be involved. The function is the physiology of the body, and then the structure is the alignment and the positioning of the body. And both of those go into making a healthy, balanced individual. So structure function care is really health care. Disease care is dealing with the symptoms, symptomatology based. All diseases are defined through the symptoms that they create. So when you're dealing with obesity in a pharmaceutical or a disease manner, what you're doing is you're talking about introducing drugs to change the obesity rate, and there are certain drugs that are well known to cause weight loss. However, it makes you less healthy. It's not a healthy way of actually approaching your care, and you usually wind up fatter than what you were before, because you're introducing more chemicals into the body. If you remember, chemicals is the whole problem in the first place.
Right.
Chemicals aren't solving chemical problems with more chemicals is
doesn't sound effective.
Really effective. And that's, we go back to the whole opiate crisis. Mm-hmm. The United States consumes 80% of all the opiates in the world, which is crazy. Mm-hmm. We only have 5% of the population. And how are we going to solve the opiate crisis? Well, where they're throwing all their money and all their resources. When they did clinical research, they said natural ways are the best way to solve the opiate crisis. And they laid out exactly what it was. Then when it was actually published, the pharmaceutical companies got their hands on it, changed the whole wording, and said, the way to handle opiate crisis is more drugs. Mm-hmm. Crazy way of approaching it. Mm-hmm. But that's a corporation that's trying to make money and isn't really interested in the health care of America or the individuals.
Yeah, and talking to some patients about their experience in our disease healthcare model and the frustration with that.
Right.
And they said the only way it's going to change is if consumers change it. It's
not going to start from our government, because our government is paid off by the pharmaceutical companies. The pharmaceutical companies certainly are going to solve the problem. That would mean cutting down on their sales by 85%. Mm-hmm. We can't really trust them. They have a huge influence across there. Really, it's the people who are going to demand the changes, and people are frustrated with our healthcare system and our food supply system. Mm-hmm. We as consumers have the greatest amount of power, and we need to make the changes. And those of us who have the time and resources to be able to find out what needs to be done need to be the ones who are out there educating the public, and the public are the ones who are going to change the course of America. Mm-hmm.
Well, on that note, let's go to break. When we come back, we're going to talk about ADD, ADHD, and the health of your children. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Discovered my wife had a brain tumor. It was removed. She's great. Thank you. I didn't remove it. I was in the other room soiling myself, but the tumor is gone, along with my ability to ever win another argument. It's not like I was winning a lot before, but now I'm retired. And luckily, my wife's not the type to bring it up. Well, once she did. She was like, I did have brain surgery. And I couldn't be like, yeah, that was like a month ago. It's time to move on, What about my seasonal allergies? We all have our cross to bear.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather practice by calling 317-848-8048 or learn more on our website at The Voice of Health Radio about how to have healthy kids. And Dr. Prather, let's talk about, we were talking about the present risks for children's health. Mm-hmm. Talked about obesity and the role that structure function care plays in that. Let's talk about ADD, ADHD, and autism and spectrum disorders. There's been a real increase in those.
Yes. One of the things is that that has been something that's been around for quite a while. It was first recognized back in the 1930s. But the rate of that has skyrocketed. Right now, 1 out of every 35 children is getting some type of a diagnosis along those lines. And the number of kids that are on medications for different types of disorders has gone from almost 0 to a huge number. Mm-hmm. I mean, in some areas, it's 1 out of every 4 children. Mm-hmm. So, we're talking
you said
about...
in some areas, 1 out of 4 children diagnosed.
Some schools, are actually on medications for something along those lines. Mm-hmm. And it's become obviously a big health crisis here in the United States. It is something that is not found elsewhere in the world. So...
These diagnoses, you mean?
The problem. Mm-hmm. It's just not there in other countries. So, what is it that we are doing to destroy our children? Mm-hmm. There's obviously something wrong here in the United States with this whole process, and there's a lot of controversy on that. There seems to be, again, the philosophy among the pharmaceutical companies of let's go after it with drugs. With chemicals. Mm-hmm. And our reasoning is that it's chemicals and drugs that created this problem in the first place. Mm. So again, what we're doing is we're trying to, it's something that has been created, a condition has been created by the chemical and pharmaceutical companies, and then they're actually coming in and then presenting a solution on that, which involves, again, chemicals and pharmaceuticals. Mm-hmm. And is that actually creating are they actually solving the problem? Or are we creating a whole new set of problems that are also involved in this?
So how can the Prather practice help with these issues?
Well, again, what we're doing is that, when you're talking about if you remember that we said that children are completely different physiologically than adults.
Right. They have the larger thymus.
Right. And their physiology is completely different. Their immune system is completely different. None of the pharmaceuticals or any of those types of things have ever been tested on children.
Mm. That they're giving children.
But they're giving them to them. Mm-hmm. The research has been completely on adults. So we are really giving our children things that have not been tested out properly to see how they respond on them. Mm-hmm. And we don't really know what's occurring. All we can do is look at the results of this and see that it's a disaster.
Okay.
Just in a short type of way, the way that we are healthcare is treating our children is not producing the results that we want.
So how does Prather practice do it differently?
Well, children really should be treated structure functionally. Mm-hmm. When we talk about for the general adult population, we're talking about an 80-20% split. Pharmaceutically, we should be doing about 20% of the healthcare. 80% should be structure function based, where we're improving the health and wellness of the individuals. Mm-hmm. The split between in children should be about a 98% structure function care and about a 2% pharmaceutical based care. So really switching how we're treating our children from a disease care model into a structure function model should be a very main emphasis with a much stronger type of a push on that than even for adults.
And why is that? Why 98%?
Well, let's just take cough medicine for an example. Adults take their Robitussin or whatever, and it stops their cough. They usually don't have too many problems with it, and they make even milder ones for children. Well, they took them off the market because the chemicals in the cough medicine kills children. It doesn't kill adults. It does kill children. Antibiotic responses in children are at a 10 times greater rate than for in adults. So children do not respond well to pharmaceuticals.
So you're saying at the Prather practice, we have more of a natural approach.
We can approach this in a very healthy type of a way that doesn't put the child at risk and still get results. Children respond even better to structure function care much quicker than adults do because of the pliability of the system. So they respond better, and then we can treat them. If it is not disease care unless it has strong risk. It is not structure function care if it has high risk. So, structure function care by its very nature is a low risk type of a procedure. Pharmaceuticals and disease care by its very definition is a high risk procedure, and it is a 10 times greater risk for children than it is for an adult as you'd put them on pharmaceuticals.
Okay, so let's go back to the care at the Prather practice, more natural. So in dealing with ADD, ADHD, I know diagnostics are very important.
Diagnostics are even more important in our care than it is in the disease care.
And why is that?
Because we're looking to see where the balance is off. Where is the imbalance occurring? Get in there and then actually fix it.
Because we're all about homeostasis. Balance.
So what we're looking at the vitamin balance, the mineral balance. We're looking at the gut flora, has a huge effect on how that's going. We're looking at using homeopathy. Homeopathy is an extremely safe, effective means of treating without any risk involved.
And I've seen it effective within 24 hours.
Oh yeah, sometimes it's immediately
with no side
effects.
effects.
Right,
yeah.
It immediately changes. So we have very little risk of any types of problems on that. So homeopathy is extremely geared towards children and a very effective means. When you go to France, for prescriptions, 40% of all prescriptions are homeopathic. And for children, it's 90%.
In France.
Because they realize that they don't want to give pharmaceuticals to children. So for adults, it's a 40%. For children, it's hugely higher.
Well, I know the royal family, homeopathy, they have a homeopathy.
The British royal family.
The British royal family physician is a homeopath.
Right.
Yeah.
India is very big, Brazil.
And Queen Elizabeth still rides a horse.
Right.
So something must be working. So you see children coming in at the Prather practice, and what kind of results are you seeing with this more of this structure function approach?
Well, we get great results in adults. We see quick changes, but quite frankly, we see quicker changes on children. They're much more pliable, flexible, and they have why people think that children are healthy is because they can rebound so quickly. They can heal up so quickly. And we find that very true. Especially with the structure function care. So children respond quicker, better, faster, a little more longer lasting than adults do. When we're working on kids, we always know that it's going to usually be a shorter amount of time with better and quicker results.
Okay, well, let's talk about some conditions that children have that are pretty common, and otitis media. If you want to explain what otitis media is. Yeah,
that's the ear infections. That's a very common type of problem why children are brought in to the doctor, and one of the more common reasons on why they're putting on antibiotics. And it's been shown through many different types of studies is that antibiotics is a terrible way of treating otitis media. It usually winds up with glue ear. The more antibiotics children take, the worse that the otitis media becomes. So antibiotics are a very, very poor way of actually approaching it. One of the things is that there's a formula called ABC, aconite, belladonna, and chamomile. It's a homeopathic formula that was put together specifically for ear problems for children. Very, very effective.
We sell that at the Prather practice.
We do.
Yeah.
We have
ABC.
many. We have many different types of homeopathics that work along those lines. We have homeopathics that cut down on fevers, as opposed to taking different types of pharmaceuticals along those lines, with absolutely no risk. And quite frankly, it works better and quicker. The other thing that we do with otitis media, I'm thinking. I can think of 20 children who were brought in with active ear infections. The parents said, look, we've already done 2 rounds of antibiotics. Child's getting worse each time. What can you do? So we go in there, we find some remedies for them, have them take it. We take them over, we do a chiropractic adjustment on them, which the kids actually like. We also will massage, do a Galbraith maneuver on the ears, which helps to drain it, and then we also do some shortwave diathermy on the ear. And by the time we're done, the kid doesn't have an earache and is doing fine. And the parents are like, what the heck? Before we left the office, it's solved. And it stays solved. So we get quicker results, we get more long-lasting results, and the results that we get are without any side effects. If your child has had 6 or more antibiotics before the age of 5, then they are 30 times higher rate of learning disabilities than the average child.
Wow. 30 times.
30 times higher rate. And so, we have an issue, we have the answer, and that's what we need to do.
Okay, when we come back, more on how to have healthy kids. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
Iron toxicity is a very big problem. Men, more than women, who actually have that problem. It's usually as one gets older. If you actually show that you have iron toxicity in your system, they won't write you a life insurance policy. You couldn't get health insurance either at one point because it was considered too much of a risk. Your chances of having cardiovascular disease, cancer, increase quite dramatically if you have a high iron. You can actually have a false diabetes. I've had many a patient who came in and said, my doctor just can't seem to get my type 2 diabetes under control. I got it later on in life. Usually they're men. Nothing that I'm taking is actually working, and we do a test on them and they show up that they actually have iron toxicity. Iron toxicity will actually give you a false diabetic reading. So I said, you really don't have diabetes. What you do have is an iron toxicity. That's changing how your physiology works. Let's go ahead and get you detoxed on your iron and gave them different ways to actually work with that. Lo and behold, their diabetes went away. It will cause damage to the heart. Iron will actually accumulate in the heart and cause cardiovascular disease. We find that oftentimes medically they don't know what to do with that. Does not respond to any of the medications or the normal types of treatments. And I get them into my office and we detox them on their iron and their heart problems go away. It will also cause liver damage. They think that they have hepatitis, trying to figure out exactly what's going on. It can also damage the pancreas, kidneys. We had someone who was diagnosed with ALS and was not responding to medications. We found that they had iron toxicity. And that's really what was going on because it had settled into the nervous system and in the brain. We detoxed on that and most of their symptoms went away. Parkinson's. High iron can give a false Parkinson's symptoms. So it's not truly Parkinson's, it's actually an iron toxicity. So that can be a tremendous amount of different problems that are going on in people that are being undiagnosed.
Right, or misdiagnosed.
Misdiagnosed, and it's actually an iron toxicity. So there can be a tremendous number of issues that can be created. High iron actually can cause cancer. Your chances of getting cancer if you are high on your iron are 6 times greater than the average person. We've had patients who came in who were dealing with cancer. We found a high iron levels in their system. We went ahead and detoxed them on that and got a remission from it. Everybody should be checked once a year, from a baby all the way up until, you die. This is actually something that's recommended by the top healthcare professionals in the United States.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
It's a beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about how to have healthy kids. And we're going into different conditions. We see otitis media, ear infections, ADD, ADHD, obesity. Let's talk about childhood asthma. Can structure function care at the Prather Practice, that's what type of care we do, help with childhood asthma?
Yeah, absolutely. We've had some amazing results with dealing with childhood asthma. So really understanding what's going on. And now, we're not saying that, especially with asthma, pharmaceuticals can be an important part of playing a role. Mm-hmm. But again, what you're doing is you're using that as a crisis type of care. It's not getting to the underlying problem and dealing with it. Mm-hmm. So what we do is we do very thorough diagnostics and try to figure out what is the underlying problem, why is the child having the asthma.
Right, getting to the underlying problem.
Now, one of the things that we have found that's a common problem is parasitic infections. So, discovering that there's a parasite in the system, what happens with asthma is you've got some increased eosinophils. There's an inflammatory reactions. The bronchial tubes can go into spasm. And one of the things that's the most common irritant in that type of situation is an underlying parasite. Now, that's not the only thing that could be happening. Mm-hmm. There could also be allergies involved with that, food allergies. That's a big testing. But the gut has a huge effect on asthma, and evaluating that and seeing exactly what's going on really makes the big difference. We've cured, and literally cured a huge majority of our asthma patients, children, by just getting in there and finding that underlying cause. And as I said, one of the main causes seems to be some chronic parasites.
Well, when you think about kids, what they put in their mouth, or
certainly,
I'm thinking of our 2-year-old grandson.
Right.
He's playing in this water table, and making sure that's clean water. You want to empty that out, but you think about where their hands have been, and they go into their mouth. And
to be honest with you, having a parasitic infection is part of the development of the immune system. So
really?
Children should actually get parasites at different times in their life to completely develop the immune system. One of the things that has been a concern with all the vaccinations is children aren't going through the normal types of childhood diseases that have been around for a millennial that we've been dealing with, and it's not developing their immune system to the proper level. Mm-hmm. So having some exposure on different types of infections can actually strengthen the immune system. One of the things that they've been experimenting with is children with a weakened immune system, autoimmune types of diseases, is actually giving them a parasite to try to stimulate the immune system. Interestingly enough, along those lines, just to give you an idea, there was a whole treatment center. They weren't allowed in the United States, but what they would do for cancer patients is they would give them a real strong dose of strep infection. And then the strep infection, they would let it really blow up in the system, and then let it take its course, and afterwards people wouldn't have cancer because it was an immune stimulant to get the system up to par. So having mothers freak out when I said, oh, it looks like your child has a parasite. What did I do? I'm a bad mom. And it's
Is that a worm?
Yeah, it's like, no. Parasites, having the body clear out parasites is very important.
Yeah.
But having a parasite is usually a normal part of the development of the immune system in a child. So, don't freak out. But if it becomes chronic and the body's not able to take care of it, get rid of it, then you have some problems. And one of the things that can develop from that is asthma. So we've been able to get in there, clear out the underlying parasite, and then the asthma would go away.
Is that because you said it's chronic when it becomes chronic?
Yeah, when the body's not able to deal with it and get rid of it, we're supposed to get infections and have a response, immune response, and then we're supposed to defeat the invading organism.
You don't hear this.
We're stronger for it. So if you never get those invading organisms,
we're not supposed to get the chicken pox. We're not supposed to.
Right, and those things. If you get those things, your chances of getting autoimmune diseases, especially MS and some of the others, decrease quite dramatically.
Decrease.
Now, measles, chickenpox, all those different types of things are not normally life-threatening. They're a mild childhood type of infection. Kids get it, they're stronger for it, and then they move on. Now, if you are low on vitamin A, or some zinc or other nutritions in your system, it can become a very dangerous type of infection.
And we talked about vitamin A, that it was about 3-4 weeks ago.
Sure.
Got a lot of good feedback.
Because vitamin A is the treatment for measles. That's what you do, and it always works. Because measles don't become a life-threatening or a major type of a situation unless you're low on vitamin A. That's when measles become dangerous. So looking at those types of things, so I would say about 70% of the asthmas are related to parasitic infections. The others are usually food allergies. Looking 70%. To the gut. So finding out what's going on in the gut. One of the things that kicks off asthma is repeated antibiotics. It clears out the gut. You don't have your normal flora. And you become much more susceptible to infections in the gut. And then the inflammatory process that happens in the gut affects the lungs. And then you get the asthma. So if you oftentimes clear up the gut, you fix the asthma. Now, you might need to be using medications in the meantime, but let's get to the underlying reason and actually get the problem solved, not just control the symptoms.
Okay. Well, we need to wrap it up. So much information. Actually, this is going to be How to Have Healthy Kids Part 1.
Excellent.
We have so much information. We will have Part 2 next week. Thank you, Dr. Prather.
Well, thank you, Lisa. Always enjoy it.
Very informative.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.